occupational health department at Stepping Hill Hospital, attending one of the drop-in flu vaccination sessions. We have one of our occupational health nurses behind and one of our consultant physicians having his flu jab, which is excellent news. We've got about 6,000 staff and we're encouraging every single one of them to have a flu vaccination this year. As an organisation, we've always done really well in having our staff vaccinated, but it's not just for the staff's own protection, it's absolutely because it protects patients. But as well as patients, it's indirectly helping patients because it ensures our staff are not off sick because they've had their vaccination. And of course, it helps their family and friends at home. So it's something that we're very proud of, our achievement on flu vaccinations, and everybody who gets a vaccination will get one of these lovely little yellow badges. So if you have the opportunity, please do have a flu vaccination at one of your GP practices. I am absolutely delighted to be able to tell you that we have achieved the accident and emergency Q2 performance of 95% of patients being seen and treated and discharged in accident and emergency within 4 hours. Given the challenges that we've been having, many of which I've talked about in previous podcasts, you will know how delighted as an organisation we are at this achievement, which is absolutely about teamwork, both within the accident and emergency department, but all of the support services and departments which surround them. That is excellent news for July, August and September, and now the challenge is on for Q3. It's been a difficult end of October, and we are seeing continued high numbers of patients who are very poorly needing our care in the department. One of the new innovations that we've put in is a community assertive inReach service. And I was advised the other day that although this has only been in place for about 3 weeks, they have already managed to ensure that patients, instead of being admitted, are discharged home to 78 patients. And that is fantastic, not just for those 78 patients, but the families that care for them. So well done to everybody, and the challenge never ends, we continue with it. The Family and Friends test, which has been introduced for just over a year in the organisation, is continuing to tell us really useful information about whether people would recommend us as a healthcare organisation to their friends and family. And we have seen around 92% of patients in the last survey saying they would be extremely likely or likely to recommend us, which is excellent news. What we want to do is understand the 8% who perhaps didn't feel the same, to check and learn from that and ensure that we give them a better experience. This is being extended at present to include other areas, including outpatients, community and day case surgical patients. And because these patients are a slightly different cohort, we're going to be using technologies such as text messaging and voice recognition telephone calls. So if you are invited to take part in a friends and family test, please do understand that it matters to us that you actually do reply, but that also we take very seriously the information and feedback that we get from you. Work is underway on our £17 million surgical and medical unit development. This is something that is going to ensure that patients of the future receive not only the very best of care, but also in the very best environment. It will also be a real boost to the staff because this has been a purpose-designed unit. It's going to incorporate 149 beds in ward areas, many with single or smaller rooms, which will certainly help on infection prevention issues. It will have theatres, it will have the surgical assessment unit and the medical assessment unit. This will be open in August 2016, Work is well underway and we're looking forward tremendously to having the units ready for our patients. In the meantime, as part of the planning application, we were required to reassess our travel plan. And so if you're visiting the hospital site at all in the next few weeks, don't be surprised to find people in high visibility jackets with clipboards who will be stopping you and asking about how you travelled to the hospital as part of the travel plan reassessment. So if you can help with that, that will help us in a way deliver the very best care in the future. And finally, we have been recognising our exceptional staff and their teams. We had an event on the 1st of October in Stockport, and this celebrated achievement of our staff and also celebrated the fact that many of our staff have been working for a long period in the NHS, over 25 years, and 2 staff over 40 years, which really takes some going. Now, we had a very important guest as our guest speaker, a gentleman called John Amici, who has an OBE, and you may well know him as a Stockport lad who made it good in the basketball world in America. Not an easy place to become rich and famous. John would probably laugh if he heard me say that. He was our guest of honour, and it was a real privilege to have him and a colleague from the Manchester Giants come to our event that we celebrated along with the Mayor and his consort from Stockport. We had over 200 staff involved, and we had awards for things such as mentorship schemes, for just the work that people were doing, for palliative care, and for many other areas throughout our organisation, both in the community and the hospital. It is always a humbling experience and a real privilege to be involved in those celebrations, and I'm already looking forward to next year's.